Hey, I'm Dr. Kethu. I'm a board-certified gastroenterologist and former professor at Brown University Medical School. Did you ever feel like your chest is on fire after a meal? No, it's not because you are secretly a dragon. It's probably GERD. And while dragons are cool, but heartburn, not so much. Today we are diving into everything you need to know about gastroesophageal reflux disease or GERD, G-E-R-D. This condition affects millions worldwide, leading to symptoms like heartburn, regurgitation, and discomfort. We will cover everything from causes and symptoms to treatments, including natural remedies and the latest advancements in medications. What is GERD? GERD is a chronic condition where stomach acid frequently flows back into the esophagus, the tube connecting your mouth and the stomach. This acid reflux irritates the esophagus lining, which is not made to withstand the acid like the stomach lining. This leads to symptoms and potential long-term damage. Although occasional reflux is common for a lot of people, GERD is when you have frequent and severe episodes of acid reflux happening more than twice a week. How does GERD develop? GERD typically develops when the lower esophageal sphincter, LES for short, a ring of muscle at the end of the esophagus, either weakens or relaxes abnormally, either too long or too frequently. This allows the stomach acid to flow back into the esophagus. Think of your LES like a nightclub bouncer. Sometimes it lets everyone in, like stomach acid, when it should be keeping the party upstairs. Contributing factors include obesity, pregnancy, smoking, and certain foods or medications. So, what are the symptoms of GERD or heartburn? Heartburn is actually one of the main symptoms where you have burning sensation in the chest, often worse after eating or when you're lying down. That burning sensation in your chest after a pizza, that's not your heart reminding you to love spicy food. It's GERD saying, maybe skip that extra jalapenos next time. Next symptom is regurgitation, sour or bitter tasting acid backing up into the throat or even mouth. Difficulty swallowing, or in medical terminology, it's called dysphagia, a sensation of food being stuck in the throat. Chest pain is another common symptom. Sometimes it mimics heart attack symptoms. So watch out when you have symptoms. Don't always assume that it's GERD. It could be heart. So that needs to be ruled out. Chronic cough is another chronic persistent symptom, especially if it is not linked to respiratory causes like allergy or asthma. Hoarseness or sore throat, particularly in the morning. Feeling nauseous after eating. These are the common symptoms. Now coming to the causes of GERD, GERD can result from a variety of factors. Diet is probably biggest trigger. Spicy foods, fatty or fried foods, chocolate, caffeine, alcohol, and carbonated drinks can relax the LES or increase the stomach acid production. Also, eating large meals or lying down right after eating. Spicy foods, caffeine, and chocolate, basically everything you love. GERD really knows how to pick its enemies. I usually tell my patients that if you eat something that is really delicious, probably you should throw it up. Another cause is obesity. Excess weight increases the abdominal pressure, pushing stomach acid into the esophagus. Pregnancy, where you have hormonal changes and also increased abdominal pressure from the baby pushing on the stomach, that can also contribute to acid reflux. Smoking reduces the LES pressure, impairs saliva production, and also increases acid production. So all that will increase the acid reflux. Hiatal hernia is another common symptom. This is when the upper part of the stomach bulges through the diaphragm into the chest cavity. This can weaken the LES, making it easier for acid to come back into the esophagus. So what are the complications of untreated GERD? One is esophagitis, which is inflammation of the lining of the esophagus, causing pain and sometimes difficulty swallowing. Next is esophageal stricture, where the esophagus narrows the passage due to scar tissue, leading to swallowing difficulties. Barrett's esophagus is a serious complication where there is change in the lining of the esophagus that can increase the risk of esophageal cancer, especially in white men. Then esophageal cancer itself, there is increased risk of adenocarcinoma. That's a type of esophageal cancer that can happen. You can have respiratory issues like worsening asthma, chronic cough, or soreness or hoarseness of the voice, or pneumonia. How do we diagnose GERD? Diagnosing involves, first thing is clinical evaluation based on your symptoms and medical history. Endoscopy is another test where we pass a camera inserted into the esophagus to check the inflammation and other changes. This is especially important if you're above 40 years of age and has GERD for more than 5 years, as you may be at a higher risk for Barrett's esophagus. Next test is pH monitoring, where we measure acid levels in the esophagus over a 24 to 48 hours, sometimes 72 hours. Esophageal manometry is another test where we assess the muscle contractions in the esophagus and LES pressure. Now, after the diagnosis, what are the simple lifestyle and dietary modifications for GERD? Managing GERD starts always with the diet and lifestyle changes. First thing is eat smaller meals. Large meals can increase the stomach pressure. Smaller, more frequent meals help reduce symptoms. Avoid trigger foods. Keep a food diary to identify and avoid foods that trigger symptoms. Next is weight loss. Reducing weight can lower abdominal pressure, relieving GERD symptoms. Elevate your head while sleeping. Raising the head of your bed by 6 to 8 inches can prevent acid reflux at night. Avoid late meals. Don't eat within 3 hours of bedtime. And then we talk about natural remedies for GERD. Several natural remedies can help manage GERD. Ginger, aloe vera, juice, apple cider vinegar. Basically, your kitchen is secretly a mini pharmacy. Sleeping position is very important. Sleeping on your left side can reduce acid reflux. The position of your stomach relative to your esophagus is more favorable for preventing reflux on the left side. Another natural remedy is apple cider vinegar. It might seem counterintuitive, but some people find that a small amount of apple cider vinegar mixed with water can help balance stomach acidity and also reduce GERD symptoms. So, how and when to take apple cider vinegar? Start with a teaspoonful of apple cider vinegar, which is 5 ml. If you tolerate it well, you can always gradually increase to 1 tablespoon, which is 15 ml per serving. And the most important thing is diluting apple cider vinegar. Always dilute the apple cider vinegar in water. Mix apple cider vinegar with 8 ounces, which is about 240 ml of water. This dilution helps reduce the acidity and minimizes the risk of throat irritation and even tooth enamel erosion. You can either warm it or just use cold water to mix it. Many people prefer warm water as it can be soothing to the digestive system. If you choose warm water, ensure it's not boiling hot, as extreme temperature can irritate the throat. The next thing is timing. Drink the diluted apple cider vinegar before or after meals. Some people find relief by taking it 15 to 30 minutes before a meal, while others prefer taking it after eating only if they have acid reflux. Experiment to see what works best for you. You can take this mixture 1 to 3 times a day, depending on your symptoms and tolerance. Start with once a day and increase if needed. Consider drinking the mixture through a straw to protect your teeth from the acidity of the vinegar. Before starting, especially if you have existing health conditions or taking any medications, consult with a healthcare professional to ensure it's safe for you. Listen to your body. If you notice that apple cider vinegar worsens your symptoms or causes discomfort, discontinue the usage. Next is chewing gum. Chewing gum increases the saliva production, which can help neutralize stomach acid. Next is aloe vera juice. This can help reduce inflammation and soothe the esophagus. Just be sure to choose a product that is specifically formulated for digestive health. Next is ginger, which is known for its anti-inflammatory properties. Ginger can help soothe the stomach and reduce stomach acid reflux. Plus, it's good for your nausea. 2 birds, 1 spice. A warm cup of ginger tea can be a comforting way to ease discomfort. Now, when it comes to medications for GERD, we recommend it only when lifestyle changes and natural remedies are not enough. Medications can help manage GERD very well when you need it. Antacids will give you quick relief by neutralizing the stomach acid, for example, Tums, Rolaids, Maalox, all those. Next category of medications is H2 receptor blockers. They reduce the acid production by blocking histamine receptors in the stomach. For example, ranitidine, famotidine, all those are good acid reducers. The next category is proton pump inhibitors. These are very potent acid reducers that block the enzyme production of the stomach acid. Omeprazole, esomeprazole, lansoprazole are some of the examples. Next one is prokinetics. They strengthen the LES and speed up the stomach emptying. That way, the stomach will move forward rather than backwards. The latest category of medications for acid reflux, they're called potassium channel blockers. The first one that is approved is vonoprazan, which is also known as Voquezna, which is the commercial name. This is the newer medication. It targets the potassium channels in the stomach, helping to reduce acid secretions. It represents an additional option for patients who don't respond well to traditional proton pump inhibitors. So, what are the endoscopic or surgical treatment options? When it comes to endoscopic procedures like Stretta procedure, which uses radiofrequency energy to strengthen the LES, reducing reflux episodes without invasive surgery. The next one is Link's device. A ring of magnetic beads is placed around the LES to prevent reflux. The next is surgical option, which is Nissen fundoplication. The top of the stomach is wrapped around the lower esophagus to reinforce the lower esophageal sphincters. So now coming to the long-term management and monitoring GERD. GERD is a chronic condition requiring ongoing management. Regular follow-ups are important to monitor your symptoms, adjust treatments, and prevent complications. Lifelong medication may be necessary for some, especially those at risk for complications like Barrett's esophagus. GERD may be common, but with the right mix of lifestyle changes, dietary changes, natural remedies, medications, and maybe even a touch of surgery, you can keep that pesky acid in check. Remember, knowing your triggers is crucial. It's like avoiding that one friend who always shows up uninvited to the party. So work closely with your healthcare provider to create a plan that works for you. After all, you deserve to enjoy your meals without the fear of a fiery eruption in your chest. Stay proactive and don't let GERD steal your joy or your pizza. Thanks for watching. Don't forget to like, share, and subscribe for more health tips. If you have any questions or topics you would like me to cover, leave them in the comments below. Stay healthy, stay happy, and take care of your gut.